So, why is gender equality important for the NHS? I mean, the first reason clearly is because it is important for NHS staff. As we probably all know, the NHS is the biggest employer in Scotland. That in itself is enough reason. 79% of the workforce in the NHS is female. Employment remains highly segregated within the NHS. Examples of that, particularly within the nursing and midwifery professions, is still around 89% of a female workforce. In personal and social care profession, it is around 81%, contrasted with the medical profession, which is around 54% male. And within all of that, we also, as many of us will recognise, still have underrepresentation of females, particularly at the most senior levels. Because the NHS is the biggest employer in Scotland, we obviously have huge issues within our own workforce and great big challenges to address there. And that's one of the things that we'll be exploring today, along with colleagues in other sectors, about what we can do to tackle gender equality within our own workforce. But I think the other reason why it is so important for us as an employer within Scotland is because of the massive role that we have in being able to influence ingrained perceptions across society about gender roles. And that obviously is particularly important, and I think one of the things that we will be hearing about again and again, I'm sure today, through all the speakers who will be expressing it much more eloquently than I can, but around, I think, one of the biggest fundamental messages we'll hear is the extent to which socially determined roles and pressures affect health outcomes far more than does the mere biology of sex. There are so many examples of that, and just to list a few and build on again what Nicola Sturgeon has already highlighted as one or two of them. For example, masculine ways of dealing with emotions in Scotland are generally not good for men's health. For example, many of the harmful coping strategies that we see, and because of that, and as Nicola Sturgeon already said, the slower uptake of some healthcare services by men in general. But equally, the emotional culture of Scotland is not particularly good for women's health either. An example of that many of us would recognise is the higher incidence amongst women generally of some particular types of mental health illness related to societal roles, stress, anxiety, etc. I think one of the interesting ones and one of the real challenges is around the whole issue of gendered assumptions that are made in the delivery of healthcare all of the time. Many, many examples of that. Just one to give you. Take two patients presenting to, let's say, presenting to a GP with chest pain. One is a female. It's known that she acts as a carer. It's known that she finds that quite a difficult role, something that she's expressed some anxiety, stress about in the past. The other is a male with no caring responsibilities, both presenting with chest pain. Either may well be having a heart attack, or either may well be suffering from stress. The point is that you don't know that, and if you go into that with an assumption, you may well make a wrong diagnosis or certainly not provide the level of care that you would seek to if you were simply looking at that person first and foremost as an individual, as well as understanding some of the societal pressures that may be coming to bear on that particular consultation. And finally, my last point around gender equality in terms of patient care is clearly, and I'm sure again we'll be reminded of this often today as we discuss these issues, is that gender issues clearly can't be looked at in isolation. Just one small example. Women tend to play quite a lot of multiple roles at any one time. I certainly recognise that one. But if you're living in poverty, you then have the added stress of much less access to many of the resources that can help you cope with all these different roles and pressures, and again, increased anxiety as a result of that. And that's just one example of where the dimension of poverty obviously has a huge interplay with gender, but we could go on all day with these kinds of examples. The reason why I think this is such an important event today in the calendar of all the massive range of equalities events that many of us will be attending over this year is I think that gender is one of the most challenging areas around equality for people to really get their heads around. And I certainly have experienced this myself in terms of our organisational response to gender equality. Heard that from many colleagues working in other areas. There's all kinds of reasons for that, about why it's so difficult to really get to grips with gender as an issue that we can work out what would be the most effective actions and how can we really take it forward. all sorts of reasons. I think one is, again, back to this societal level of understanding that it's kind of all sorted, isn't it? We've got equal opportunities legislation, and that's all sorted. Kind of following on from that, it's sorted apart from, yes, there's maybe still an issue, but it's about women in employment and isn't seen any broader than that. It's such a difficult issue to see, I think, for lots of different reasons. Partly it's just so big because it is about all of us. Everybody in here has a gender identity. So that makes it very difficult to actually become specific and in any way see it as a problem. It's also sometimes just far too small. An example of that would be issues around transgender. So many times that is not recognised as an issue. It's not taken seriously just because it's so difficult to provide reliable data or evidence to convince people that clearly there is an issue. Clearly there is an issue because people, transgender people, we do recognise suffer some of the highest levels of discrimination within the health service and in every aspect of their lives. But because it is such a broad issue, it is so difficult to see, and many of the consequences, I think, are accepted and therefore seen as quite small. And that's leading on to the last point, that I think often the differences in outcomes which are related to gender are seen as inevitable. And that's back to the point that isn't this just about men and women being biologically different? So just a range of different things, so many of them actually impacted upon the way that we've all been brought up to believe, think, talk, discuss, that get in the way of us really getting to grips with how can we actually tackle this agenda on a day-to-day basis. Just to finish off a little bit about the role of NHS Health Scotland. We are doing, as many people are, a number of different things around this. One of our biggest roles is to embed gender equality within our own health improvement work, and we have a role in leading health improvement across the NHS in Scotland. We see, as many people do, equality impact assessment as a key tool in achieving that. Just one example, Ready Steady Baby is a document which Health Scotland produces, which goes to every household in Scotland where a baby is expected. Our recent equality impact assessment work there, one of the things it has done is highlighted the opportunity to challenge gender stereotypes around parenting, and that's something we hope will have an impact. As I say, that's a document that is quite far-reaching. We have a role in supporting the NHS generally with EQIA, and gender is included within that. We have an important role to play in terms of making data and resources available within the NHS and to partners beyond that. One document that I certainly referred to quite a lot in terms of preparing for today was a document recently published by Health Scotland called Dimensions of Diversity. I don't know, Marez, if we actually have that available today. It's available online. We will be able to provide the links to that. It's a document I would highly commend to anybody who's not had a chance to see it yet. What it does is it sets out, for the first time, bringing together across a range of different characteristics which will impact on people's experience of health, gender being one of them. There are 13 altogether in the document, gender, age, carer status, etc. But it brings together, I think for the first time, a vast amount of statistics, information, analysis, which is really helpful in anybody trying to do some of the practical stuff in terms of making the cases and putting the arguments. So I recommend that one to you, and we hope to build on that work in the future as one of our particular things we can offer, as I say, around making data and resources available. I think one thing, just before we move on from data, that strikes me that's particular about gender, of course, is it actually isn't a huge abundance of data on gender, certainly in terms of the male-female dimension within the NHS, which is very different from some of the other quality areas. But relatively speaking, we therefore have much more than we have to work on in other quality groups. But we could do so much more to really explore that data, make the best use of it, analyse, take it forward. And I think that's one of the challenges I would like people to take away and think, we have this data, how can we actually use it? We have a history of, and will continue to be working closely in partnership with many of the other people who are here today, Gender-Based Violence Project, who are running workshops later on. The Workforce Directorate in Scottish Government is one of the options that we have to influence the way that the NHS workforce is challenged to consider gender equality within its own ranks. And lastly, but not least, the big role that we have is in terms of helping to raise awareness and facilitate learning and support around this very important agenda with events like this one. So delighted to be hosting the event and wish you a very inspiring and informative day. Thank you.
Thank you.